Great. Hey, everybody. Welcome to another episode of Manny's Take. I'm really excited today. We have a tremendous guest, Traci Belmonte. Traci, thanks so much for joining us.
Thank you very much for having me, Manny.
I really appreciate you joining us. Traci Belmonte is a conservative media personality, analyst, and writer. She's an award-winning educational expert with over 21 years experience working with children. She has been featured on various TV and radio programs such as The Kelly File, Hannity, Wilkow Majority, David Webb Show, and Breitbart News. And she's also affiliated with Voices for Seniors. And I interviewed Vivian Zayas recently, who started as one of the co-founders of Voices for Seniors, and she's tremendous, and Traci's involved in that effort. Again, Traci, thanks for joining us. Can you maybe add a little to your bio for our audience, and they can know a little more about you? I know you've done a ton of TV, as I mentioned, and media.
Well, I never thought my life would take this turn where I would be fighting to protect our seniors, because that's where I am now because of what had happened to me. And I'm sure we'll get into that. Most of my focus was on protecting children all these years, and it still is. I'm an expert in education, so I speak out on educational issues. I don't like indoctrination, whether it's of the right or left. I want to go back to teaching kids to be critical thinkers. And that's pretty much where my TV or radio experience has come in. That's where my focus has been. And of course, I'm a very proud conservative, constitutionalist, and I've worked with a lot of GOP campaigns, including the president.
Absolutely. I know everybody's seen you on different shows and in the media. Recently, though, I understand that you've been involved with COVID issues through your dad, and let's just get into that. What happened with your dad, and what's the situation with that?
On March 11th, my dad had neck surgery. It was a 5-hour surgery. He was a very big, burly, full of life man, healthy, except for his neck and joint issues, which were causing balance and walking issues, but heart, everything else, all good. On March 19th, he got transferred to a nursing home facility for rehab because the doctor did tell us going into surgery that 20% of patients would need rehabilitation. And unfortunately, he was one of those 20%. Now, we could not see the escalation. We're not psychics, so we couldn't see the escalation between March 11th and March 19th with COVID. So we had no idea that Cuomo was going to mandate that these nursing homes and rehab facilities take in COVID patients. We thought that my dad would be very well protected against COVID because they had shut down this particular rehab facility 2 weeks before they were even mandated to. So we were like, oh, this is great. They're doing fever checks on their staff. They're not letting anybody in with COVID. It turns out they were allowing COVID patients in. Now, even before the COVID issue, Manny, my dad was being neglected in that home. He was made to sit in his own waste for hours. He didn't have his teeth brushed for weeks. And in fact, he was made to eat with his face down in a dish like a dog because the aide wouldn't help him because, quote, he wouldn't help himself. So we had a lot of issues before then. Now, had we been allowed family visitation, like one of us dressed in PPE to go in there, we would have seen the condition that he was in. Because he was only in that rehab for 11 days when we asked to get him out. And he was released on March 30th. I picked him up. I was just told about his medication, signed off on that. Nothing else to report, nothing, just 2 people needed to help him go to the bathroom, things like that.
Sure.
He was in terrible shape. We got him home. He collapsed on the driveway immediately. And it took 3 grown men to drag him into the house because he begged us not to call an ambulance because he was afraid they were going to put him back in that hellhole. Now, unbeknownst to us, he caught COVID in the facility.
No, I'm sorry.
Yeah, well, later on that evening, I opened up an envelope. This is the best part, and best means worse here. I opened up an envelope, and it says that he was running fevers, and it said that he was, quote unquote, a COVID suspect. No one ever told us, never tested him, they never treated him. And we, as a result, all ended up getting COVID in my family for taking care of my father. So on April 1st, he started to spike in fevers, and we called an ambulance. and we never saw him again. He was immediately put into ICU, sedated, and in a coma. We never got to see him. We weren't allowed because of the restrictions. Plus, we all ended up testing positive for COVID and getting the symptoms shortly thereafter.
Oh, so sorry to hear that. It's tragic.
Thank you.
So when your dad was released from the rehabilitation center, should he have been released, or should he have been sent to a hospital? Do you know?
Yeah, he should have been sent to a hospital. And if I had seen him first of all, they had his feet bandaged, so I couldn't see his feet. But his hands were swollen to triple the size. His feet were swollen to triple the size. And he had these big sores, and I can send you the picture. Maybe you can put it in your video or link to it somehow. These ulcers all over his feet, almost look like burn marks, and they were going up his legs. I'd never seen anything like it. He had told us in the facility that he was running fever, that the nurse told him this. And when we had called the nurse, they assured us, no, he wasn't running fever. He was 98.6. He's fine. But it was on his paperwork that he indeed was. So there were a lot of lies told, a lot of cover-ups. We now know that at least 40 people died in the facility of COVID.
Terrible.
Even before my dad was released, they knew COVID was in the building, and they didn't tell anybody. And my dad and other people, like Vivian's mother, they're not counted in the tally of 40 because they died in hospitals later on. So there's really no telling how many people died, but it became a COVID death chamber.
Do you have any idea why so many people got COVID from that facility? Is it they didn't test their employees, or the space itself was infected with COVID? Do you have any idea how it was so contagious?
Well, I don't believe that they used effective prevention protocols. Now, my dad, just by luck of the draw, happened to have his own room, but I do know that he was in rehabilitation and physical therapy with another parent who died of COVID before he did. So there was a lot of contact between patients that way. I don't know if they were cleaning their equipment appropriately. On March 23rd, they had called to tell us that somebody in the unit did have COVID, and that they were very well isolated and nobody would have contact with my dad, because we wanted to pull him out then.
Sure.
They wouldn't let us pull him out because he was not well enough to come home, and insurance would not pay for his stay. We couldn't afford thousands and thousands of, who knows how much it would be. So I don't think that they had adequate prevention protocols. And we know that fever, not everybody gets a fever. I can tell you, when I had COVID, my fever didn't get above a 99. So they don't consider that fever. They might not have sent an employee home.
Right.
And putting together all these stories now, and it's the same horror story over and over. These were people that were in there for leg wounds and, after surgery, and basically well people. But their roommate was coughing all over them, and then they so they should have stopped anybody from rooming with each other. That was the first thing.
So what's out there in the public is that the people who unfortunately got corona and then died from it in nursing homes or rehabilitation facilities were in really poor health. Mm-hmm. That's not necessarily true, right? People were in good health, and then they had surgery like your dad, and then they went to the rehab center, and then they caught corona at that rehab center, right?
Right. My dad was in a weakened condition because he had a 5-hour cervical surgery. I can't even explain what they did.
But he was otherwise in good health, right? He had no underlying health problems.
He was a referee. He had just retired from being a referee. He was a football referee for 35 years. He was a legend in my community for that. I mean, he was besides his joint issues, he was a healthy man, and he had better cholesterol numbers than me. And I go to the gym 5 times a week, right?
Wow.
Before it became illegal.
What about, was there an order, and there seems to be some confusion about this, mm-hmm. and I guess it's the underlying cause or issue is always about money, right? It's always following the money, but there supposedly was an order from New York State, from the governor and the commissioner of the Department of Health for nursing homes, rehabilitation centers to keep patients who had coronavirus in those facilities and not send them to the hospitals. I'm not sure if it's financial related or if it's because they didn't want the hospitals to have more patients and they wanted so many available beds. I mean, do you know anything about that?
Yeah, Manny, they wanted to keep as many beds open in the hospitals as they possibly could, but they spent at least $150 million just on one hospital, an auxiliary one outside of Stony Brook Hospital that didn't even see one patient. All these COVID patients could have been put there, or they could have used the USNS Comfort that President Trump sent. They didn't use any of these auxiliary hospitals. Now, I have not had the time to follow the money on that, but I wonder who got those bids. Were they friends of Cuomo? It makes no sense. And what I want to know, and I keep asking these public officials, and of course they don't answer me, when you were coming up with these policies to send COVID patients into the nursing homes and keep COVID patients in the nursing homes, did any of you say, this is the population that is most at risk and maybe it's not a good idea to do this? I mean, did a kindergartner could think of that logic to me?
Right.
It makes absolutely no sense. Again, they say it's to free the hospital beds. Was there money? Were they saving money on Medicaid, Medicare, all those things? I don't know. I don't like to think of the governor as that sinister, but maybe it is.
Yeah, it's horrible, right? And I know we had. I live in New York City. I know we had the ship here, the Comfort. We had the Javits Center, and they went well out of their way to set up and makeshift hospitals, even within Central Park. Yeah. And yet, I'm not aware that they were either used at all or clearly not fully used. So I'm struggling with, if you have sick patients from a policy perspective and you're trying to do logistics in terms of figuring out who needs what help, where, and what assistance, and it was a big logistical exercise, the number of beds, the number of ventilators and all that. Now you have the ventilators and you have the beds, then wouldn't you treat those who need it? And it's not a matter, to me, and I'm a lawyer, not a doctor, but it would be a diagnosis. So I would treat, first I need a facility to treat. We have those, or we had those. Then we're able to determine who's sick from who's not sick. I remember when Corona first came out, people were questioning, do I have it or not? People couldn't get tested. But if we know your dad and others had it, then why wasn't he treated accordingly? It's breaking my heart to realize and to think that they released him knowing he had it to you. How could you have treated him? What did they expect you to do?
I don't know. And they didn't tell us. So my 73-year-old mother was exposed and she nearly died. But by the grace of God, we all survived it. But because my mother was so ill, when I tell you she had a straight fever, and it would be about 100, 101, but 14 days, she couldn't eat. She couldn't keep anything in her system. I really thought she was going to die. And there were times I wanted to call the ambulance. She would not let me. She was going to die. She'll confess that now. So I had to make all the healthcare decisions for my father. And I would get these phone calls every day, and they were never good. And the doctor would tell me, listen, your father was talking one moment, and the next moment we had to intubate him because that's how this disease is. 1 minute you're okay, and then the next minute your blood oxygen just drops ferociously. And here I am fighting the same virus. My boyfriend's fighting the virus. My brother is fighting the virus, and my mother is fighting the virus. I do believe hydroxychloroquine helped to save our lives because my brother chose not to take it, and he was the only one of us that got double pneumonia. For my poor father, had they got him treated earlier, maybe put him on the hydroxychloroquine protocol then, it could have saved his life. We'll never know. But they waited so long, and they didn't tell us. And it's unconscionable that they wouldn't tell us that they suspected he had COVID. We could have gone out in the community and infected, there's no telling how many people.
That's just a horrible situation. So you actually said you took hydroxychloroquine as a treatment, and it was effective for you.
Yeah, a lot of people ask me about this all the time. Now, I can't say that when I took it, I felt miraculously better. I felt awful I felt awful. It took me 4 weeks to recover, and I still don't have my taste and smell back, even though I'm negative now, and they say it will come back, but it does take some time. And I do have some muscle and joint issues from the virus as well that are lingering, and the doctor says yes, that can happen. But it wasn't like a miracle. I didn't take it and feel instantly better.
Mm-hmm.
I do believe it mitigated, because I've been around children so much. I have a very strong immune system. And I think that my immune system was overacting because I am young and I am healthy. And I believe that blunted my immune system response and helped me to not develop the COVID pneumonia like my brother did. I mean, look at the anecdotal evidence. My mother, my boyfriend, and I all took the hydroxychloroquine protocol, and we did not develop the pneumonia. And the one of us that didn't take it he developed double pneumonia. So,
yeah, I interviewed a friend of mine, Dr. David Samadi, a couple of weeks ago, and we talked specifically. He was infuriated when President Trump was talking about hydroxy, and the media just went off on him.
Mm-hmm.
And the little I know about it is that according to Dr. David Samadi and others, is that it works early on in
Mm-hmm.
preventing inflammation. Right.
Yes.
And that's the real thing that gets people with the respiratory aspects of it, in terms of once inflammation starts, that's when it gets out of control. So I'm glad that you're better and your boyfriend's better, and your mom and your brother.
Mm-hmm.
Tragic. Sorry about your dad. It just breaks my heart. It's really sad. What are you doing about it? I mean, what can we do about it? I mean, it just seems like this governor literally gets away with doing anything that he pleases, and he's glorified by the media. And I can't wrap my head around it. And my arms.
It's like, and you can't even be surprised at this point, because that's what they do. It doesn't matter that you killed probably at least 12,000 seniors by your negligent policies. He's a Democrat, so we're gonna, herald him up. But he tells these great stories about his mother, Matilda. Oh, look, he's so human. The Cuomo show every day. But I'm working with Voices for Seniors, and we're working on not only awareness, reform. I have been going through the laws like crazy, and we've come up with some common sense legislation. It's time. It's time federally to legislate, because the last time the laws were redone was 1987, and it's time at the state level to include families. Families need a Bill of Rights. Had one of us in our families been able to go into the nursing home and see the condition my dad was in, we would have called 911 immediately. He may not have died. In fact, I'm positive he would not have died.
You couldn't go because of COVID, because of social distancing?
Right. Even to this day, I have a grandmother in a nursing care facility. I have the antibodies. I'm immune, at least for the time being, and they still won't let me go in. She's dying of stage 4 lung cancer, very comfortable, which is why we have not moved her to hospice. They won't let me go in and see her. I mean, there's no reason why. Families are the first line of defense, so families need a Bill of Rights.
Sure.
How many people are dying of loneliness? They've been alone and isolated for at least the last 3 months. And yes, I get why they did it, but we can wear PPE and go in and have, even if it's 10 minutes. They need also to legislate that there needs to be mandated doctor hours. Now, they get away with not having doctor hours because there's mandated nurse hours, but most of the care is given by these CNAs who took a weekend course in healthcare.
What is a CNA?
They're basically aides, home healthcare aides, and they take a course and get certified, but a lot of them do not have continuing education mandates, which they need to, and a lot of them have no business taking care of the elderly.
You think that's a cost? That's probably related to cost, right? Because they're obviously a lot cheaper to pay per hour than a doctor or a nurse.
Of course. Plus, we need incentives in these nursing homes to attract better quality employees, because the hospitals pay more. So you're going to go to a hospital and get paid more and get more benefits than you would in one of these nursing facilities.
Sure.
The work is, in my opinion, the work might be even more difficult, because you are dealing with, a lot of elderly, very, very frail people. But, the CNAs need continuing education. We need to up the mandates and up the requirements for them, because some of them really don't have any business in those places, in those facilities. I would love to see at the federal level, if it could be done, that they could mandate or legislate that a governor or state health officials cannot legislate their way out of liability, because we know Cuomo was spurred on by the nursing home lobby, and he snuck a little provision into the state budget at the last minute, which a lot of lawmakers didn't even realize happened. Even Democrat lawmakers are coming out against this. And his mandate stated that the nursing homes are not liable for what happens during the COVID times, which is a recipe for abuse and neglect. And you get outcomes like my father and thousands of other people.
Yeah, I mean, it all makes sense. I mean, it's all rooted in common sense. I mean, nothing that you're saying is outrageous.
No.
I had some experience with nursing homes with my grandfather. He died in 1999. He was a couple of months shy of 100. Believe it or not, he was born in 1899.
Wow. God bless him.
And we lived in Brooklyn, and he lived with us, and I would go see him. And he had a roommate. And he would tell me, and I had no experience with nursing homes before that the roommate was being abused by the attendants. And I said, why? He said, well, because he doesn't have family visit. So he was pretty in tune to what was going on. My grandfather, that the people who had family, who were in the nursing home, the residents there that had family that came to frequently visit them, they were treated better. Because the staff knew that people were going to check up on them.
That's right.
Other people who were just, they were neglected. And we had a situation where he fell out of a bed and he was all bruised up and he was really upset, and he made me aware of some things that were horrific. And I think any abuse type situations are horrific, but in particular against our seniors who are patriots, who are veterans, who were teachers, who contributed to society and built our country, is beyond tragic. So I think we need not only laws, but we need some type of law that is so strong that it should be easy for that individual's family to litigate, because it's just completely disgusting if we live in a society where we have no law and order, like all the stuff going on right now with the civil unrest, and then where people don't feel safe, and then we entrust these facilities with our family members, our grandparents, our parents, and they're so negligent, and they do things that lead to unfortunate the death or illness of these people, and we have no recourse to go after them. I mean, sometimes suing in terms of injury, whatever, against like a nursing home, you get money. I mean, so what, right? I mean, it's the injury. Your dad unfortunately is passed, and then what happens is, well, you litigate against them, and let's say you get some kind of settlement, but that doesn't rectify what happened. And I really appreciate your efforts, and I can't give you enough praise, because it's so important to shed light on this. And that's why I appreciate you introducing me to to Vivian, and I'll do whatever I could do with Voices for Seniors, because we can't bring enough attention to this. We were getting some attention, you were getting some attention, and then now with all the civil unrest were happening, the media is focused on that, and it seems like again, Andy Boy has been able to get away with something without any kind of recourse, and the media glorifies him, and Zucker's up there, and I've been reading more and more about this. It's so tragic how many people have been impacted by this, and it just seems like the news cycle has absorbed it, and it's a done deal, and it's not. I mean, your dad died tragically. Other people's parents have died. It's not a done deal, and just because the news isn't talking about it, and Cuomo's not talking about it because the news isn't talking about it, we need to force him to speak to this. We need to force the agenda, and I champion your efforts. I mean, I would be, happy to get involved however I can, but I think we need federal regulation. And I'm a lawyer, but I'm not a big regulation kind of person.
Same.
But you look at kind of what's going on right now with all the civil unrest, right? Where people are being looted, where all this stuff's really bad things are happening. There's a lot of violence, and the governments, the local governments, are not letting the police do their jobs. The local governments are interfering to what extent the nursing homes, we don't know. And it's all, hidden from us. And we need to bust through that. And the only way we bust through that, we really have two choices here. One is litigation, and you can only do what you could do with litigation.
Mhm.
And the second thing is some type of, federal oversight. I think we need a federal monitor. I know like Elise Stefaniak has called for this,
Yes,
and
yes.
Nicole Maliotakis and others. Like, let's get the federal government in, because if we have, let's face it, Tracy, if we have some kind of a Albany appointed monitor or overseer, what is that person going to do? With all due respect to them, I mean, are they really going to find, if Cuomo hires them and New York State hires them, are they really going to find fault? And
that's how it's been now, Manny. Like the health department, with all of the, there is a deep state New York, and there are all these liberals at the helm, and they investigate themselves. It's, you're putting the criminals in charge of the investigations, and nothing happens. They get a slap on the wrist. They get a whopping 6 months to change their protocols if they get nailed on something. I mean, it should be changed yesterday if there is an abuse or neglect citation, but it's not. Plus, these citations are not public knowledge. So I can't go to a website and look at, wow, this nursing home was cited 19 times for infection protocol prevention. I'm not going to put my loved one there. I'm going to put them in this one.
Mm-hmm.
So there's nothing like that even, the families can see, and that's wrong.
Oh yeah, there should be like a rating, like
Yes.
at certain places, like at a restaurant or something, that the Department of Health evaluates them, and they have a rating, they have a letter or a number rating, and then you can make that determination. But what I would love to see would be, what happened with your dad in terms of all the records. I mean, clearly there should be all those records. Have you been able to get those records? Get all those medical records?
We got medical records sent over. Most of them came on a floppy disk. Like I'm not floppy disk. A CD floppy.
CD.
Showing my age.
I know what you mean.
And our computers don't run disks anymore, so we couldn't get into them. So we gave everything to our attorney, and we've unfortunately found out that Cuomo is bulletproof when it comes to litigation. He has something called governmental immunity. I'm considering, when the dust settles and I figure out what to do, because we are going after the nursing home legally, legally with citations and civilly, even though there's no amount of money that could make everything that we've gone through okay at all, but we want to hit them in the pocketbook.
Of course.
Hurt them a little bit and keep them and hold them accountable so that these mistakes don't happen in the future, because COVID won't be the last pandemic or outbreak that we see.
And we need to get the press, right? We need to name them and shame them, and they should be shut down. I mean, that's the thing.
Right.
They should be shut down. This should not happen to anyone.
No.
We know it's happened repeatedly. Until we know what's going on, it's a dangerous place. Shut it down. Just shut it down.
Right. Exactly right. And, we're not going to stop. Voices for Seniors. We're not going to stop until every single senior in the United States is not only respected, but they're protected, because they are our national treasures, and nobody values them in this throwaway culture of youth and beauty and what's the next thing. Because, even with the George Floyd tragedy and all of the protests and everything going on, the civil unrest in this country, in another month, that's going to be yesterday's news.
Right.
Will be, and they'll be on to something else in the next outrage. Just like, they were focusing on nursing homes for 2 weeks, and then, George Floyd took it off the front page.
Right.
We're going to make sure that this stays on the front page until there is lasting reform, accountability, and justice. And I am considering maybe putting out some sort of GoFundMe to try to sue Cuomo personally for this. If I pay for it myself, I'm sure I can find an attorney that will take it. We may have to take this up to the Supreme Court, but there's these cowards up in Albany or any of the state offices where you live, where anybody's watching this lives. They should not be able to get away with such severe gross negligence. They should be able to have themselves insulated.
I can't agree with you more. I mean, it's these people in these nursing homes and rehab facilities, and my mom's 82, and she was in a rehab facility herself. Mm-hmm. I mean, it's tragic in every state. It's not just a New York issue, and they're clearly underrepresented, and there's clearly abuse. I mean, there have been videos that have come out again where people, where they have some kind of disability or whatever, and they're physically accosted by the people who work there. And I even heard horrible stories about sexual abuse. I mean, it goes on and on and on. Okay, the most disgusting things in the world happen there, and we need to take care of our seniors. And for some reason, it's been the most underreported story for years. None of this is new. It's new now and more acute because of COVID, which is terrible. But a lot of this stuff has been going on for way too long. And like you said, we don't value our seniors. Everything in society is about young kids and young people and hip people, and we kind of forget, who we are and where we came from. So, I can't get behind, this effort, more strongly, than I'd like to. Sign me up. I'd love to get involved in any way I can. I'd love to get my audience and viewers to get involved. What's the best way for them to get in touch with you, support this effort? How can they reach out to you?
Well, they can go on the website, voicesforseniors.com, and they can also join the Facebook group that we have, Voices for Seniors. That's become, even for people who had their parents or grandparents abused in nursing homes, not even COVID issues, they've joined in the fight with us because they know that this isn't just about COVID. Because, Manny, look, we're not getting any younger. I mean, we're young and vibrant now. But that could be any of us.
It's going to be us. It could be us, right?
Right. We could be put in one of these places, even just for rehab for a little bit if we need surgery. So this affects every single person watching, every single American. So we please join us in the fight. We need you.
And what about you? What are your social media handles, and what are you on Facebook and Twitter?
Well, right now I have taken a bit of a Twitter hiatus. Okay. Unfortunately, Jack does not like me tweeting at Killer Cuomo. So Jack has given me a timeout, but I will be back at Voices for Seniors. You can follow us there for now. I plan on doing at Protect Our Seniors as another handle. So you can find me there on Twitter. And you can find me on Facebook at my name is Traci Ann, Traciann. Facebook will not allow me to change my name because I've changed it too many times. Social media.
Well, thanks so much. I really appreciate you taking the time and telling your story. And I'm sincerely sorry that you had to go through this. But sometimes things happen and people rise to the occasion.
That's right.
Through tragedy, and I think you're doing that, and I can't commend you anymore and support your efforts. I appreciate that you're being a champion and you're championing these efforts with Vivian. I think that's tremendous, and again, happy to support you in any way. And I really implore my audience to follow Traci, to follow Voices for Seniors, and get behind this effort, because we all have parents and grandparents, and like Traci said, we hopefully, God willing, when we're 80, we'll be in a situation. Potentially, we'll live long enough to make it, but we could wind up in that same situation tragically, and we need to make sure that we take care of our families and take care of each other. So it's important that we focus on this issue and we don't lose sight of it and let it get in another news cycle. And we put pressure on our leaders. We put pressure on Governor Murphy in New Jersey, put pressure on Governor Cuomo in New York, and all your governors and local leaders that are continuing to create bad situations and put our families in dangerous environments. Traci, thanks again. I really appreciate it.
Thank you.
This is Manny Alicandro from Manny's Take, and I'll see you soon.